How do I choose between a cortisone injection or a platelet-rich plasma injection, or PRP? This is a question I get asked all the time by patients in my office and other healthcare professionals. So what algorithm do I use? So I usually use cortisone if you are in acute pain, like you just strained and sprained or have a small tear in that meniscus. You might even have a little effusion, or you're having an acute inflammatory response to some arthritis in your knee. Maybe you injured your shoulder and you really can't move it much and you're starting to get a frozen shoulder. Those acute moments, I want to help patients get out of pain. So I talk to them about the cortisone. I tell them this is going to do nothing for healing, but it is going to decrease inflammation. So it's not just masking pain, it's decreasing inflammation that causes the pain. And after about 3 months, it's probably going to wear off. Now, I decide on platelet-rich plasma if someone's coming to see me because something has been bothering them for a while. So it's not acutely painful. It's more like a dull toothache pain, and they've been dealing with it for some time. And the reason behind this is because platelet-rich plasma does not work quickly. It takes 2 to 3 weeks before it even starts to work. And so we really need to have patience for platelet-rich plasma. And when people are in acute pain, they don't have that patience. So I give the cortisone sometimes in those acute moments. I start having that conversation about the platelet-rich plasma and say, hey, don't wait for the pain to come back this acutely or this strong. Please come back at a time where you can deal with the pain and you can have patience and we can let the PRP do its thing. PRP, again, for those who don't know, is platelets, growth factors, and cytokines. Very concentrated, 8 times the amount than what's in your blood. And we inject that into the area and it can work for up to 6 months. We can see progress over time for 6 months. So that's the algorithm I use for cortisone injections or PRP. Let me know your thoughts below.